Hello, everyone. Thank you for tuning in to this educational webinar. I just want to say, of course, that I send you everyone my best wishes during this public health crisis, especially those that have been directly affected, had family members directly affected. It's not an easy time. It's a very difficult time on many levels, many layers to this. We are being fed a lot of information rapidly, and it's changing very rapidly daily. And I think there's a lot of confusion and a lot of fear, obviously. And my philosophy is that if we can understand a little bit more, we will have less fear. If we have a little bit more education, a little bit more non-biased information, a little bit more reasonable thinking, in my opinion, usually fear subsides somewhat. So that's my goal with this webinar. My goal is to educate as best I can. My goal is to provide unbiased information and solid information on how to maintain your health, how the immune system develops, and things that we can do that are pro-health instead of fear of disease. Now, in no way, shape, or form, because we're focusing on this perspective, in no way, shape, or form am I diminishing or discounting the amazing work at hospitals and by ER doctors and nurses and ICU doctors and nurses. Illness, infection, death, it's all ugly. There's nothing pretty about it. But these things happen through history. But I'm not going to focus on that so much, because I think that's part of the issue is we're focusing on the fear and the hysteria a little bit too much, not a little bit, a lot. And the perspective in the minority is, okay, why are we not focusing on why there's so many asymptomatic cases? Why are we not focusing on the fact that this is pretty much the people that are being affected are already kind of compromised, health compromised, and we'll talk about the reasons why. And there's always exceptions, but we don't make decisions, or we don't really make our health decisions or scientific decisions based on the outliers. We make it on the high probability cases. So when we have uncertainty, so we're not going to discount any of that. Okay, we're not going to discount the good work and the amazing work and the bravery and the courage and all of the people that our lives are saved and the people that are discharged from hospitals. So I want to just say that. Okay, but again, that's not going to be our focus. Okay, our focus is on how we and what we do to make ourselves stronger and more resilient. So whenever we have uncertainty, right, which is the time we're living in right now, this is a time that uncertainty always breeds stress, okay, and fear and stress. It's our human condition. It's how we're wired. Some more than others, but in times of uncertainty and in turmoil, it's a stressful state. And again, my personal philosophy is that the more understanding we have, the more knowledge we have that's accurate and that is reasonable and unbiased, the less stress or less fear that we will have. The problem is, who do we trust? What information sources can we trust? That's an answer I really don't have for you. All I can say is, as far as this webinar goes, I'm giving you the evidence based as we know it. I'm giving you information that really, for the most part, is verified, and it's not opinion. Okay. So let's go here and let's just talk a little bit about. We'll start with our immune system. Okay. Now, don't get excited. We're not going to go through an immunology course here. I promise you. Okay. There's a lot of characters in dealing with there's a lot of cells and characters dealing with your immune system. Much more than a Game of Thrones episode, by the way, and that's a lot. So, except we're not going to be obviously talking about or having any sex or violence on this webinar, which and most of you are going to tune out now. But anyway, so there's a lot of characters, right? There's a lot of cells, right? But I just want to go through it very simply, not all of it, just a couple little highlights here so that you have a basic understanding of how your immune system works, all right? So you have your barriers here on the left, right? So on the left here, you have your barriers, okay? That's your skin, okay? Protects you, okay? Your respiratory lining, the lining of your respiratory tract, very important now in coronavirus. The lining of your gut, which we'll see later, those are related. And then the lining of your reproductive tract, right? These are all letting things, there's barriers there so that they let certain things in and they don't let other substances in. It's kind of like just kind of like a velvet rope, so to speak, or a barrier or a gate, right? So you have barriers in your as part of your immune system to protect us, right? Everybody kind of is, of course, knows the lymph system or the lymph nodes, right? So if you have a child who's sick, okay, oftentimes they have a swollen lymph node, right? That means the immune system has been activated. So immune system is set up in a very basic way in two systems. You have your innate immunity here. That's as your rapid response. So if we're going to use military analogy, your innate system is kind of like the infantry, right? They're on surveillance all the time in your bloodstream, just looking for bad guys all the time, right? And then you have your adaptive immunity here, your adaptive immune system. This happens over time. Now, we're going to go through a couple of these cells just so we are familiar with them, so that when we talk about more specific things later, then we'll have a good reference. All right, so we have your macrophage here. Okay, so the immune system happens over days. We'll talk about that. So these are like scavengers, again, on surveillance all the time. And then you have your neutrophils. I want you to remember that name for later, okay, the neutrophil. Right, that's kind of similar to a macrophage, except they're more of a killer, so to speak. All right, and then you have your antibodies. So everybody has heard of antibodies, right? So you have your antibodies are part of your adaptive system, right? So you have, let's say you're presented with a bacteria or a virus that comes into your body, and these macrophages and these other cells, they attack it. They present it, if they don't kill it, right, they present it here to your adaptive immune system. And this is why it takes days. This takes days for these antibodies to develop, right? It's kind of like, so the infantry, they capture the bad guy and then they bring him back to base, and then they bring him to the higher order servicemen, and they may question them a little bit, so to speak. All right, it's kind of like in real life. They just bring them back and they have coffee with them, they talk, they give them some food. That's how it works, right? And eventually you develop some antibodies. Okay, so you kill the virus, kill the bacteria, and develop some antibodies, right? And then you're immune for life. Okay, or theoretically so. Hey, it doesn't always happen like that, but the most time you have antibodies. So the next time that you're exposed to that same virus or bacteria, then you have a memory for that. Okay, you have a memory for that, and you actually have a structure that can attack that bacteria or virus. So that's called an antibody. All right. Now, there's another substance here, or another structure, another part of your immune system that many of you probably have read about recently, and that's what's called cytokines. Now, cytokines are a special kind of part of your immune system. They are pro-inflammatory. Now, what does inflammatory mean? Inflammatory, you've heard inflammation. Inflammatory means that there is an upregulation or an increase of your immune system, right? Mostly your innate immune system, your macrophage, your neutrophils. There's an activation, right? There's an activation of some cells to basically respond when the brains particularly, when the body senses that it is in some kind of danger or there's been damage to it. Now, there could be true damage, like an injury, or if you have a bacteria or a virus in your body, or it could be just something like a tissue injury, like an injury, tissue injury, like a wound or a cut or a sprained ankle or whatever it is. Okay, that also increases your immune response, right? And we call that swelling sometimes. When you swell, that's an immune response. So we have these cytokines, and they are pro-inflammatory, and they kind of invite other cells to the party. So that's why I got this little party here, the people dancing, right? So if you've ever been to a bar mitzvah, all right, if you've ever been to a bar mitzvah, you know that dancers are hired to get everybody dancing, right? Well, that's kind of what cytokines do. They kind of bring people to the bar, they kind of get everything going, and they're pro-inflammatory, and they upregulate all these immune markers, these immune cells, right? If you're Latin, you may have a quinceañera, right? Sweet 16 party. Well, that's not a good example. There's no cytokines there because people are already dancing there. Okay, so you don't need people at a Latin party to tell people to dance, right? So these cytokines, and if you don't know what I'm talking about as far as a bar mitzvah and a quinceañera, you need to get out more. All right, well, when you're allowed to go out anyway. So anyway, these cytokines help activate the immune system. Okay, the pro-inflammatory. All right, that's what I want you to remember. Right. So this innate immunity, this adaptive immunity, this is quick, this is slow. Right. Now, there's chemical, physical, and mental stresses that can increase your immune system. Chemical, physical, and mental stresses that can increase your immune system. Important to remember, right? So when we're seeing all of this information lately about how to boost your immune system, you don't boost your immune system, okay? You develop a good immune system over a lifetime. But boosting your immune system, you boost your immune system by getting sick, right? Because an upregulated or boosted immune system means that there's inflammation, all right? And we'll talk about that many times going forward. Alrighty, let's move on. All right, so how do we develop immunity? How do we develop our immune system? What are the factors that are involved with developing our immunity? Well, there's been studies on twins to develop, okay, what percentage or how much is involved with our environment or how we grow, what is our environment that we grow up in, what stresses do we have, what is our food, what is our exercise level, what illnesses have we had, how is our mental health, and how is our sleep. These are all environmental factors. Well, overlying that, of course, are your genetics, okay? Your genetics play a role in most all of these, okay, in some way, shape, or form. So both our genetics and our environment are very important when we're talking about developing our immunity. So we're going to go through these little factors, okay? Because again, what is this this webinar is about how to develop your immunity, or why certain people may be more immune than others, and how do we replicate that? What are the things that we can do to increase our defense, okay? To increase our resilience, to increase our health, to increase our wellness, to increase our mentality, to increase our capacity to exercise, to get better sleep, right? These are all factors that are going to lead to how one is susceptible and another person is not. Okay. So over a lifespan, right? Over a lifespan. Now you're going to see this arc here. You see this upside down U, right? This upside down U. This is kind of the curve of a lifespan, right? So you have, at birth here, right? You develop, you're learning, you're developing, you're growing, and then we reach middle age, somewhere around here. Hopefully that's when we have the height of our function through middle age. And most of us want to, if we keep this peak, most of us are trying to keep this going. Eventually it's going to decline, but we want to keep that functioning very high. And this is why we have, the huge anti-aging movement in the country, right? Because people want to stay young, of course, right? But we will have an eventual decline. By the way, and this is a side note, okay? This line here of decline in the healthiest people, okay? In the healthiest people, this line will stay plateau, and then eventually toward death, it just falls off. Okay, so you stay healthy longer, and then you will have, so and so quick death, right? Whereas if you're sicker, this is prolonged. Okay, there was a great book in the 80s called "We Die Too Long and Live Too Short," right? That's kind of example here. We want to be living longer, and then you'll end up with some kind of natural cause or something, right? The famous Jack LaLanne is famous for this. Okay. Famous quote by Jack LaLanne, he's like, "I can't die, it'll ruin my image." Okay, and that's what happened. Jack LaLanne lived to his 90s, he got pneumonia, and then he was passed, right? He didn't have these long chronic diseases that were drawn out, right? So where are we now? Sorry, I got off track a bit. Okay, I do that. So we have middle age here, and then we have our device. So let's bring it back to the immune system. All right, so the immune system, we develop early immunity as a baby from breastfeeding. Okay, we get certain chemicals, certain immunoglobulins, certain antibodies from our mother breastfed. So there's definitely advantage to breastfeeding for the immune system. We'll talk about the gut health later. Breastfeeding also initiates proper gut health, gut bacteria, proper activity in the gut, and that's going to have a direct relationship on immunity. Okay. Now I wrote hygienic versus overexposure here. So as we develop and as we develop and come into contact with certain pathogens and microbes, okay, in our life, which is totally normal. So years ago, there's something called the hygienic theory, okay, whereas children and kids that are not exposed to pathogens on a regular basis, they tend to have a little bit more or more prevalence of allergy, right? So this is a theory, the hygienic theory, and there's been studies with kids that grew up on farms versus kids that did not, and the kids that grew on farms that had a much different immune responses and immune challenges and immune immunity than children that were never exposed to or were exposed less to certain pathogens. Okay. On the flip side of that is overexposure. Okay, so if you're overexposed to, and we know that infections can trigger other illnesses, right? We know that infections can trigger autoimmune disease. We know that overinfections can trigger chronic inflammation. So the balance between these two is tricky, right? If you're a parent, or if you're worried about your child getting sick too much, and there's genetic factors of why one would be susceptible, obviously, and then we have these environmental factors that we're talking about. Okay, so we have this balance between too clean of an environment versus too much exposure to pathogen. And there's going to be genetic factors on why one is going to be probably more troublesome than the other, right? But these are the general, developing factors of immunity as a kid, right? Middle age, we'll talk about, again, most of what we're going to talk about today as far as factors go. The middle age is going to be where we're going to be emphasizing these things. Okay, and then at old age, during old age, your immune system obviously is challenged because we'll have less cells. Okay, it's the term is senescence, right? We're going to be aging, and there's going to be just less immune cells circulating. Okay, we also become, as far as the immune system is concerned, it's always in a state of either pro-inflammatory or anti-inflammatory, right? So inflammation is going to be a buzzword that we're going to talk about a lot, and rightly so. So as we age, our immune system tends to become a little bit more pro-inflammatory, right? And that's going to carry a host of other issues that we'll talk about. Okay, and just a little data point here is, yes, 90% of flu deaths are in people over 65 years old. Right. So as we age, there's certain things that everybody will have throughout their life. If you live long enough, everybody will have arthritis. If you live long enough, everybody will have heart disease. If you live long enough, everybody will have certain visual changes. Okay, because there's certain proteins in our body, like certain collagen proteins and elastin proteins that make up the structure of our body, that just don't last forever. They don't turn over. Like your liver cells can heal, your skin cells heal, right? These other cells don't heal very well, right? So everybody will have these things, and when you get them, that's based on the environment. That's based on what you do and your behaviors throughout your life, right? So flu deaths over 65 years old, well, there's many reasons for that, okay? We just mentioned that the immune system there's actually less surveillance, right? There's less actual cells looking for pathogens, but also there's the structure actually of the lungs, right? The collagen that makes up the lungs, whether it expands like a balloon and then it deflates, well, that becomes a little bit more rigid, right? So the actual health of the lungs is compromised, right? Due to the natural aging process. Now, how do we prevent that? Potentially, how do we prevent that? Well, that's where exercise comes in. Okay, and that's what we'll talk about next. Okay, so with exercise, again, we see this upside down U, right? This upside down U is a theme with the body, right? Many. Sorry, that's it's a remix. Let me erase that. The body, many physiological factors of the body will carry and have this U shape of a shape. Now, for those of you that forgotten your math or can't read a graph, I'll just go through it, and there may be some of you, but I think most of you get it. If not, grab your 8th grader and bring him or her in the room, and they'll explain it to you. So this is the x-axis here, again. And I also believe, a side note, I should have said this before, but my personal philosophy is people can learn things much more than they think they're capable of, right? If they're given the right motivation. Right, so that's why I get a little bit technical, but not so much. So this is the y-axis, right? So as exercise intensity increases here on the x-axis, you have a corresponding your immune health increases on this y-axis. Well, and then we have zero exercise here, or physical activity. Well, what's your immune health when you have zero exercise and you're sitting on the couch? Well, that's about zero. All right, so your immune health is compromised. Well, if you have a moderate amount of exercise intensity and you have good immune health, the highest immune health, that's here in the moderate level. All right, we'll talk about that. However, if your exercise is too intense, or if there's too frequent and you don't give yourself enough time to recover, well, then what happens is we have this U shape and it comes down and your immune health is compromised. Some would even argue that it would be down here. Okay, follow this? So we have this U shape, so there's a happy medium somewhere, right? Well, you know, the saying is, okay, we need everything in moderation, right? Well, we see that, right? So what is moderate exercise? What is moderate exercise? Moderate exercise is brisk walking. Moderate exercise is jogging 3 to 5 times a week, okay? Moderate exercise is swimming, some resistance training, rowing, right? What is intense exercise? Intense exercise is multiple marathoners, okay? Elite triathletes, people that are doing high intensity exercise daily, okay? The general rule is anything over 2 hours a day is actually, that's pretty intense, okay? So listen, this is regarding immune function, okay? This is an immune function talk. This is not performance, right? I'm an athlete. I'm over here a lot of times, okay? I understand it, but I do things to protect myself. But we're not talking about performance. We're talking about immune health, okay? Immune health, right? I lied. I don't think I'm here. I'm more like here. But anyway, that's neither here nor there, okay? So what is this here, 25 to 50%? Well, with moderate exercise, we have good evidence, multiple studies that show that with moderate exercise, cumulative moderate exercise, we have a 25 to 50% reduction in upper respiratory infection incidence. No supplement will do that, I promise you, okay? And this is aerobic exercise, okay? Brisk walking, jogging, swimming, rowing, okay? Even a cardiovascular weight training or resistance training in a cardiovascular way, okay? This is huge, okay? 25 to 50% reduction in upper respiratory infection, right? So if you're a moderate exerciser, you should feel good about building your resistance, okay? Now, somebody out there is saying, well, I know somebody that died of coronavirus and they were young and they were healthy. Well, those, again, are outliers, and I guarantee you there was something else going on in their body that made them not so healthy, okay? So those are outliers. We don't make decisions based on outliers. We base it on what the high probability is, all right? So 25 to 50% reduction in upper respiratory infection, moderate exercisers, okay? Well, what about this? What about over here when we have this intense exercise where we don't recover? Well, there's a cytokine here again that we see, and I'm bringing this up because and then there's something called interleukin 6, IL-6. All right, we'll talk about that numerous times going forward as well, right? So there's been studies done with marathoners, following them post-marathon over a number of weeks, and they find that people that have run marathons, okay, trust me, I'm not against marathon, but I have to give you the information here as far as what we know, how elite or intense training by recreational athletes, what the data says is that those people will have increased risk of upper respiratory infection by 4 to 5 times compared to either sedentary or moderate exercisers, okay? So intense cumulative exercise seems to affect, in a negative way, immunity, okay? So we have this U shape. So where do we want to be? We want to be here, somewhere in here, all right? Now, if you're performing, right, if you're performance, then there's other strategies that we can use to make sure that we protect you if you're a person that has to perform and you're an athlete and you're over here. There are things that can be done that are more protective, that can help you maintain your immune function, okay? And we'll talk about some of those things. All right, everybody with me, hopefully? All right, let's move on. Okay, so nutrition, all right? So I'm not going to we could do a whole seminar on just nutrition, but we're not going to do that, of course, because I want to try to keep some of you at least with me. So we're going to do some basics on nutrition, okay? So what we see here is on the right is basically anti-inflammatory foods. Anti-inflammatory, well, alcohol in moderation. Okay, I put the alcohol there, but alcohol is in moderation. So the data shows that alcohol in moderation is okay and it's beneficial, right? But anti-inflammatory foods. So most of the research is around, and most of you know that I think heard of the Mediterranean diet, All right, so we want to have a good amount of unsaturated fats, which means that it's a lot of oil, olive oil, nuts, walnuts, almonds. We want to be using good fats, avocados. Okay, and we want to be eating a lot of colors, right? A lot of different colors. Like they say, eat the rainbow, right? Oh wait, that's wrong. That's not the right rainbow. Sorry, that goes over there. All right, so yeah, the Lucky Charm. Sorry, I don't know how that got there. Is Lucky Charms like the best cereal ever when you're a kid? We can take votes later. All right. So this here should look attractive to you. This here, this up here, this bowl of fruits and vegetables. This should look very attractive to you. We see humans see in color. Colors should be attractive. Okay. There's a reason. There's a reason for that. Okay. Same way down here, this nice bowl of vegetable soup, that should be attractive. Okay. Colorful, bountiful. All right. So anti-inflammatory diet, Mediterranean diet, unsaturated fat, fish, cold water fish, salmon, halibut, trout. Okay. We want to have some good fibers, right? So, rice, not too much rice. There's other issues with rice, but some nice grains, oats, starches, they're okay. So carbohydrates get a bad rap, but if we eat a balanced diet and you're not, you don't have immune sensitivity to like gluten and things, it's okay. It's very good. Okay. Very good for you. Okay. As far as fiber, we'll talk about more fiber in a second. So, but the staple is earth food, plant-based, high fruits and vegetables. We've heard about this since we were little kids. Okay. There's the reason why we don't eat more, or most of us in the country in Western diet don't eat more on the right. Well, there's many, obviously socioeconomic reasons, but is because all these foods on the left, the donuts and the fast, high fat, high sugar foods, most of these food, they taste good, right? And we have something called dopamine in our brains that respond to sugar and fat and things that taste good. Then you add stressful lifestyle, you add time crunches. So it's very, very difficult to fight those urges, frankly. There's studies with little mice and the damn things, they choose sugar over cocaine. We put them in a maze. They choose sugar over cocaine. That's how strong the response of sugar in your body is. Okay. So but we have to keep trying and keep learning. There's a lot of, again, more socio-political, economic reasons why we still have dietary imbalances in this country. But what it comes down to, and what we know is, and let's get back to the word inflammation. We know that we're overfed and oftentimes undernourished. Okay, so we're overfed and undernourished, and we need to have more high nutrient dense foods that are low calorie. And that's why I particularly am a big fan of soup, because especially like a nice vegetable based soup with some protein, that is a high nutrient food that doesn't have a tremendous amount of calorie. And that's what we want. And the opposite over here is we have high calorie, but oftentimes not very dense food, but it is kind of satisfying in a way because it satisfies those urges that we have, and it feeds our dopamine system, which is our reward system. Okay, so that dopamine system gets kicked up. It's kind of like when you gamble or go on a roller coaster or sex or any of these things, that increases your dopamine and you want more of it, right? So we're fighting these natural urges by this food industry that has high sugar, high fat content foods that taste good. Okay, so these also taste good. All right, these have sugars in it too, but just not in the intensity amount or the volume that these do. Okay, so we need to be focusing on Mediterranean type diet, anti-inflammatory diet. Moderate alcohol is okay. What's moderate alcohol? In my opinion, 1 drink a day. In the research, they say it's a little more, but 1 drink a day is fine. Okay, in my opinion. Okay, this is, by the way, this is Stag's Leap Petite Syrah. It's amazing. So if anybody wants to give me a gift, that's nice. All right, so hopefully we understand that. Very basic stuff. Okay, as far as diet goes. Okay, easy to understand, I think, hard to practice, of course. All right, so let's talk about the microbiome a bit. Okay, what's your microbiome? Everybody knows about, I think, has heard about gut health. Okay, or the bacteria that's in your gut. And there's a tremendous amount of research coming out in the past 5-10 years, of course, even longer, that relates the health of your gut or the health of your colon, all right, and the level of bacteria, the type of bacteria, which is based on the type of foods that you eat, and overall health. Particularly, there's a tremendous amount of research with mental health and psychiatric illness. But we also have we have some good info regarding how that can affect lung health. And the reason why is because we go back to the lining, the barrier of your immune system, the lining of your gut, the lining of your respiratory tract. They are very much related. Okay, it's called the common mucosal immune system. Okay, the common mucosal immune system. So the lining, the mucus lining of your gut, the mucus lining of your lungs, they share blood flow, they share immune cells. Okay, so what happens is you eat certain foods, those get digested, and that changes the certain bacteria that's in your gut. Those bacteria are very active, and by digesting certain foods, they release certain metabolites we call certain markers, and that changes your immune response, that it changes the actual level of certain immune cells. Now I wrote here, or I typed in here, the IgA. That's called an immunoglobulin. Okay, that's just part of your immune system. That's one of the Game of Thrones players that we didn't mention before. All right. So, but what I want you to understand is IgA lines your lungs. It lines your gut. It's like an initial first responder for your immune system in the lining of your gut and in the lining of your lungs. And whatever's going on here will also affect whatever's going on here and whatever's going on here. Very, very important, and actually a pretty exciting area of nutritional and physiological research. Okay, and these T cells, they are part of your adaptive immune system. Okay, how you develop more antibodies. So whatever's going on in your gut will also be transferred through the bloodstream and through the lymph system, and your lungs and your brain will know about it. Okay, so how do we keep what is the format for maintaining a healthy gut? Well, there's many. We're not going to go through the whole thing, but it does start with breastfeeding. Okay, we mentioned that before. It also starts with, there's a relationship to how much antibiotic exposure you've had as a child. Okay, particularly in the first couple of years. Okay, so antibiotics will change the gut. Those of you that have had to take antibiotics, let's say for Lyme disease or something, you know that it's recommended that you take a probiotic to help keep your gut healthy. Okay. And then we have fiber. Fiber is super, super important for your gut, okay, for many reasons, like oats. And if you're gluten sensitive, then there's oats, there's lentils, and there's legumes, and all these other kind of substances that are good. Okay, bananas, artichokes, these kind of things, right? And to keep a variety of foods. Again, we have a color, we taste the rainbow, right? We have all different kinds of colors. So nutrition doesn't have to be that complex for most people. We can get into super specific areas when we're treating certain diseases, but for the generally healthy person to want to develop a healthy resilience, a healthy immune system, it's really just about eating a bunch of different colors, a different variety of plant-based, earth-based foods, some fiber, have some clean water, some lean protein, fish, chicken, and of course it would help likely if you were breastfed as a baby. Okay, but that's not your decision, of course. Alrighty. So let's move on. Now I want to cover a couple of supplements. All right, I'm not going to cover too much because this is not an in-depth, comprehensive nutrition lecture. But I do want to cover a couple of supplements because, damn, I don't know why people are so emotionally attached to vitamin C all of a sudden. Okay, maybe because it's easy to access and just people want to feel like they're doing something positive for themselves by taking some vitamin C as a preventative measure. Well, I'm sorry to say that, as far as prevention goes, the data is really not good on vitamin C. All right, as far as preventing illness, preventing infection. The gold standard for reviews and literature is what's called the Cochrane Library. And this is a famous study of over 100,000 people. So vitamin C preventing and treating a common cold. Well, what Hermilia found in this study was that vitamin C, with people that take vitamin C versus people that don't take vitamin C, there's no change in the incidence of infection. Okay, there's no change in how often somebody got sick, right? What there was a change in a small change in the duration of sickness. So if a cold lasts 7 days, then there may have been a 12-hour difference or a 1-day difference in the people that took vitamin C versus that didn't. But there was no preventative advantage. Okay, now, so we have prevention versus treatment. Okay, now treatment is different. Okay, treatment is different, especially when we're treating very ill people like COVID-19. And it's also different if you're talking about IV versus oral. Okay, most of the good research is IV. Now, the important thing to understand is with treatment, particularly with very sick people, you're treating people that have become vitamin C deficient. Okay, you see fever here. So fever increases your metabolic rate tremendously, up to 50%, and some research says more, okay, probably more. So your metabolic rate increases 50%. You need more oxygen, you're using more antioxidants, such as vitamin C, so you can become deficient, okay? So that's one example. So that's why I give IV vitamin C to very sick people. There's good research with chemotherapy and cancer patients. There's good research with what's called sepsis, is when you're severely ill and you get an infection in the blood. Okay, they give IV vitamin C because we know that they're vitamin C deficient because their metabolic rate is through the roof. Okay, now what else did this study say? Okay, we talk about excessive exercise or high intense exercise. For the marathoner, the ultra endurance exerciser, they become also vitamin C deficient. So we can supplement there. I'm not going to give numbers because this is not, I'm not giving, really treatment advice here. Okay. But we can do that another time. But so people that are ultra endurance or in high intense exercise, high intense military training, and if people are working or competing at extremely cold temperatures, right? These vitamin C has been shown to be effective to prevent illness in those populations. Okay. All right. So again, vitamin C, a little bit misunderstood, and a lot of the practitioners that are touting vitamin C as a preventive, they talk a lot about basic science research and whether they know it or not. Okay. Nobody's perfect. It's hard to know everything. Okay. It's very hard to know everything. And none of us do, okay, frankly, obviously. So basic science, there's basic science research which is done in a lab, right? Petri dish, animals sometimes, right? And then there's clinical science research. Clinical science is what actually happens in human beings, okay? Do human beings have less sickness? Do human beings have increased health from a certain treatment or medication or behavior change? Well, many times practitioners, they use basic science research to promote their treatment or their touted supplement or drug or whatever it is, okay? They use basic science research, and that's not right. In research, we call that, we have to translate basic science to clinical science, and that's what's called external validity. Does the same result happen in a clinical stage as it does in a basic science? And if it doesn't, we call that lost in translation. Okay, that's a Bill Murray movie, right? Actually, if you haven't seen that movie, good movie, directed by Sofia Coppola, Girls Rule, go. All right, so we become lost in translation. Okay, so we have to be able to recognize this. So this part of this webinar is education, hopefully. And now you'll have, if somebody comes to you and says, I have the best, treatment for X, Y, or Z. Well, and it's researched. Well, okay, what kind of research, my friend? Is it basic science research or is it clinical? Has it been proven? Has it been not proven? Because we don't really prove. We can just kind of change the narrative of what we know currently, right? Is it established to be effective in a clinical way, right? Does it actually help people, right? So we have to be able to recognize that. Okay, so I just thought that was important. Hopefully you understand that. All right, so let's talk about vitamin D. All right, vitamin D is it's a vitamin that actually kind of acts like a hormone, right? Acts like a hormone. Now we're talking about some good prevention, okay? Because we have some decent data, okay, right here, vitamin D to prevent acute respiratory tract infections. So vitamin D does act like a hormone, and it's not, but again, it's not an immune booster, Okay, vitamin D is not an immune booster. Vitamin D is actually, and has a lot of different functions, as you see here. For the most part, it's a regulator, but it inhibits some immune function. And we talked about those cytokines. Okay, there's that IL-6, that interleukin 6. Vitamin D inhibits this, or stops, or slows down this interleukin 6, which is a very pro-inflammatory substance. Okay, so vitamin D is actually somewhat of an anti-inflammatory, right? So how do we get vitamin D? We get it from the sun. Most of you know that. Okay, it's very difficult to get through food, which is why we often supplement. Okay, especially people that live in the United States, north of Atlanta, north of LA, that kind of latitudinal line, right? So the rate, or the amount of supplement varies individual. So I guess I'm not going to give you a flat number, because it can vary, but this is the basic range where people would want to supplement. And this is arguable, but this 30 here, kind of when you do a blood test for your vitamin D, this is arguable. Some people think it's 20, other people think it's much higher, but this is a good happy medium here. If you're above this level, then you have a healthy level of vitamin D. Okay, and vitamin D was most famous, really discovered because it helps bone metabolism. It helps you keep your bones strong, but it does many, many other things in the body. Particularly, it is an immune modulator. Okay, it also regulates what's called these T regulatory cells. And if people have an autoimmune disease, that's important because these help keep the immune system in balance, so it's not overactive. So vitamin D is oftentimes used with people that have autoimmune disease, such as multiple sclerosis, lupus, rheumatoid arthritis, etc. Okay, but that research is kind of ongoing, right? So vitamin D, we like it. Okay, vitamin D is good. We like the sun. 15 minutes, 20 minutes in the sun, depending on your skin type, depending on your history of burns. 15 minutes to 20 minutes in the sun with no sunscreen, and that should be good. Okay, in the wintertime, supplement. Right? Or just take a flight to Miami if you live in the north, or wherever you are in the world, go somewhere warm if available. Whenever actually airplanes start flying again. Anyway. Alrighty. Next. Okay, we're going to talk about some sleep, everyone's favorite subject. All right. So sleep, highly, highly important, hugely important. Okay. Why? Well, is sleep an active or passive process? Well, sleep is a very active process for the brain, for the body. It's a healing time. By the way, you see these people on the left here? This is dating. This is marriage. Okay, or so they tell me. Or this could be also, this is pre-COVID. This is post-COVID. All right, we'll have a little fun there. All right, so sleep. Let's get back to the important things. Sleep, very active process. We develop our memory when we sleep. We develop what's called brain plasticity when we sleep. But sleep is a very pro-inflammatory time. So you see these down here, all these stressors, right? These are your pathogens, these are your virus and your bacteria. This is your gut health here, your gut bacteria. And then this is life, all right? Environmental stimuli. If you're not eating well, and if you have some mental stress, which we'll talk about in a second, then that, again, remember we said that stresses come in all different forms: chemical, physical, mental, right? And the immune system responds very similarly to all of them. So during sleep, if you have high input of these stressors, so to speak, then that's going to increase your level of sleep regulator. It says here sleep regulatory substances. Yeah, those are inflammatories. All right. So this is why when you're sick, you don't sleep well. Right? When you're sick, you get congested. When you're sick, things swell. Right? If you have back pain, if you have any kind of pain, a lot of times it's worse late at night when you're sleeping or in the morning, right? Because things are swollen, things are irritated, right? It's a time of inflammation, it's a time of healing. But if it's excessive, then we have problem, okay? A major problem with having a pro-inflammatory state, and that continues throughout the day, right? And it's a two-way street here, because you can have these stressors come in, but if you're not sleeping, then that's going to create a vicious cycle of, again, a pro-inflammatory state. All right, so not good. And we know, we have research from shift workers, people that work midnight shift or work all night. We know that their chemistry, their hormonal system is changed. We know that they live in a pro-inflammatory state. And I've seen it with patients. I've seen it, people that work the night shift, they just tend to have a little bit more, when they have an injury or something, it's just heals a little slower, right? They have a little bit more imbalance toward pro-inflammatory state. Okay. All right. So sleep, very important. It regulates your immune system is regulated during sleep. If we can get into more of an anti-inflammatory state and help balance this out, then that will help decrease, help modulate or balance your overall immune response. Okay. So mental health. Okay. Mental health. Oh, by the way, sleep, the cutoff is like about 7 hours, right? For most people. Okay. Everyone has a different circadian rhythm. Okay. Every different rhythm. But for the most part, most of the research says 7 hours is a good cutoff point where we see, disease versus health. Okay. All right. So mental health here. Okay. We'll talk about a little bit about mental health. All right. Because we talk about psychological stress or emotional stress, and we've been talking about inflammation for the most part. All right. So we have different factors that are leading us to talk about mental health. And the two of the major ones are depression and anxiety. All right, anxiety being the number one mental illness, basically, against, at least in the United States, possibly worldwide. I don't know the data on that, but I know in the United States, anxiety is definitely the number one, with depression probably not lagging far behind. So mental health, we have this thing here called resilience. Okay, resilience is partly inborn, partly genetic. Okay, is how resilient, how your mental state, how you react to things. Okay, level of depression, well-being. Your overall mental health is going to have a direct effect on that systemic inflammation that we just talked about. And what does inflammation mean? Inflammation means that your innate immune system is increased. It increases the surveillance, it increases its activity, right? But not necessarily in a healthy way, right? Because it thinks, again, your immune system responds to the body when it feels like it's in danger, some kind of attack. And it's left over from our normal, our evolution as hunters, so to speak, right? The classic analogy is, you see a bear, you see a lion, and you become very, very nervous, right? You become your sympathetic system, your fight or flight system kicks in. Well, that has chemical consequences, right? And if we live a daily life that is mentally stressed, we have this chronic, mild inflammatory state because we're putting our bodies through this pseudo danger, then that has consequences over time, right? And that's kind of the point. So people that are prone to depression and anxiety tend to have a little bit more pro-inflammatory type of responses in their immune system, okay? And most of you, I think, have heard of cortisol, right? So cortisol is kind of the anti-inflammatory, or at least it attempts to be. It's a response to stress, okay? Cortisol is a response to stress, and it also has a circadian rhythm, which means it kind of it rises and falls according to the light and dark, the course of a 24-hour period. And cortisol really should be highest in the morning because it wakes us up. So people that can't sleep or have trouble staying asleep, and they wake up in the middle of the night, like say 3 or 4 in the morning, 5 in the morning, and they feel tired, like there usually means that their cortisol is out of balance, right? So that's no good, right? Because we just talked about sleep. So if you're not sleeping, it becomes pro-inflammatory. If you have this high depression, high anxiety, it becomes pro-inflammatory, and then you have this cortisol, right? So it becomes this vicious cycle. All right, so I'm painting a pretty grim picture here, but we have some solutions. Okay, so we know that we also know that when we are under stress, the brain becomes very selfish. Okay, the brain becomes very selfish because it wants energy, right? So stress, uncertainty causes the brain to use more energy, and that can create stress in itself. And we see an upregulated immune response, subtly. Okay, very subtle. Okay, we'll talk about nocebo effect in a second. Okay, so along with that resilience, okay, when we talked about that resilience, right, this has to do with just overall mental health and resilience and how we deal with change. Okay, so most stress and that uncertainty that we talked about in the beginning that comes from oftentimes altered an altered current state of the world or affairs, or a current state of what you expected. So you expected one outcome, or you expected one thing to happen, and it didn't happen, right? So this can kind of go back to childhood. That's why resilience is said, the amount of resilience is said to be partly genetic and partly environmental. So I gotta say, you tell your child that you're gonna have a special event or something, you're gonna take them somewhere special, they're gonna go for ice cream or something, and then something happens where you can't go, right? And then the child throws a temper tantrum and complains, and some kids react very poorly to that situation. Other kids will react a little bit better. Well, that's changed expectations, okay? And your expectations are dependent oftentimes on past experiences. So what your past experiences have given you, the current expectation, when that doesn't match, that causes stress. Now, the point is, are the healthiest people, right, are the people that can habituate, or we call those habituators. So when your expectations don't match the current affairs, okay, how well do you habituate to that situation? Okay, can you shift your attention? Can you create new goals? And the people that are mostly more toward the optimistic side of things tend to be able to react a little bit better to those situations. Okay, they become solution based, and we're dealing with that right now. Okay, I see a lot of innovation. I see a lot of people, changing their goals, changing their attention in order to survive, in order to develop and maintain their livelihood. Frankly, okay, that's those are positive habituators. Okay, if we cannot do that, if we cannot change our current state, or shift our attention, or shift our goals, okay, then that usually results in some kind of conflict. This is from research. We also see certain levels of discrimination, and we see certain levels, the people that cannot habituate, these are more people that are going to fall into conspiracy theory, and I don't want to get into a whole big psychological talk here because it's really not my expertise, frankly. But we do see people that can habituate versus people that can't habituate. We see different results in their health. Okay, and that's the point. Okay, and again, it has to do with this. In these inflammatory markers, there's these cytokines and these interleukins. They tend to be a little bit lower in people that can habituate a little bit better. Okay. And if you can't, then there's ways that we can do that. There's obviously psychologists and therapists and things that we can talk to, but there's other things that we can do ourselves. Okay, so one of those is, and there's a tremendous amount of research on meditation. Okay, now it's simple. Okay, oh, you just breathe and everything will be fine. Well, it's not that simple, but it actually is along the lines of that. Okay, so we do focus on the breath, but we focus on breathing because it helps give us a sense of control. Okay, it is a very cognitive exercise, a very brain-based exercise when you do controlled breathing. Okay, and we know that when we do controlled breathing and we really concentrate and focus and on our bodies and on our inner workings and the mind and our breath, we know that causes changes in the brain, and it causes a positive change in the brain as far as inflammation goes, and it causes a positive change in the brain as far as something called our vagus nerve, which is our wandering nerve that it goes into all our organs, and it actually is one of the main ways that we can change that sympathetic state, what we call a fight or flight state, to a resting state, our parasympathetic state. Okay, we do that through our vagus nerve. We can do that through breathing. We can do that through many other techniques to help decrease the stress response and get us out of that fight or flight, which has been shown to decrease inflammatory immune markers, without a doubt. Okay, so meditation-like practices, just focusing on breathing. There's people that you can talk to. I can refer you to other people, Laura Donna Trandu in Fairfield. I'm in Connecticut, local here. But obviously in this world, everybody is open across the world because of telehealth and virtual visits. So Laura Donna Trandu, Michelle Feeney is also in Westport. These are two people that I know and trust. Okay, that can help you with these kind of practices. Okay, so we want to become more left brain. Okay, the vagus nerve, meditation, high brain control of the body, of the breath, of breathing. There's relationships to weight gain. There's relationships again to inflammation. So these are very practical things that have far-reaching effects to control stress, depression, anxiety, etc. Okay, but it has to be done in a mindful way, and oftentimes we need help and we need guidance. Okay, because it's not often easy to do. All right, so that's a little bit on mental health for you. Okay. Now, disease burden. So we do all these things. You know, people. Somebody out there is probably saying, "Oh, we do all these things. We're gonna die anyway someday." Well, yeah, but when? Okay, because you practice good mental. You try to get enough sleep. You practice good mental health, and we have certain illnesses that made us stronger. We eat well, and we try to exercise moderately. Okay. Yeah. So what? Somebody says, "Okay, so what?" Well, so what means that over 100,000 people studied in JAMA 2020. Over 100,000 people, and no study is perfect. This is an epidemiological study over 15 years. Okay, the healthiest people develop disease 9 years later than the unhealthiest people. That's almost a decade of living disease-free. I think that's pretty significant. A decade of living disease-free. Okay, and not just immune system. This is all disease. Okay, and they didn't even really measure nutrition in that study. It was just physical activity and weight and smoking and alcohol. Right, that's where we get moderate alcohol. Moderate alcohol was actually beneficial in that study of over 100,000 people. All right, so 9 years is significant. So it's not just you know, that's 9 years of being able to see your grandkids. That's 9 years of being able to still walk and do the things that you like to do. That's 9 years of not having a respiratory infection that's going to put you in the hospital. That's 9 years of being able to go to birthday parties and go travel, et cetera, et cetera. Okay, so yeah, these things have cumulative effects, and I think that's where we're missing the boat, and we're not talking enough about the strong, healthy people and why they're immune. Okay, why are they immune? We have a novel virus that the humans have never seen before, and most people are immune. That's amazing. People should be saying that's amazing. And again, I'm not discounting anybody that's sick and that's died. Okay, again, disease is ugly. You know, death is ugly. This happens throughout history, but we're not talking enough about the 99% of people that are not succumbing. Okay, why is that? All right, so let's talk about two cases here. So, and don't get intimidated by this graph here. I'm just gonna show you a little bit of what's happening with the immune response. Okay, so this is a 47-year-old female. Okay, this is the first patient reported. They did immune markers on this first patient reported with coronavirus. Okay, so what I want you to see is this 7-8. See, when we said the adaptive immune response, we talked about the adaptive immune response. Okay, that's your T cell, that's your memory type of immunity, right? Well, I said that takes days. Yeah, this is at day 7 and day 8, which is appropriate and almost optimal for this person. We see an increase. This shows an increase in immune activity. This is a boosted immune system, people. All right, this is what happens when you get sick. You get a boosted immune system. Okay, but this is healthy because in this case, because down here it said this person actually was very had a mild case and recovered, right? And it says here that similar to the early adaptive immune response right here, early adaptive immune response might correlate with better clinical outcomes. Okay, why did this person have an early adaptive immune response? They had a healthy immune system, a healthy response. Okay, while they were sick, they recovered well. Why is that? Okay, well, I'd like to find out. We'd like to know, because that's a healthy, normal response. Okay, whereas we have this person, and we already kind of know the reasons why. Okay, but because of pre-existing illness. Okay, because pre-existing illness. Now remember, I talked about these neutrophils. Okay, these neutrophils right here, those are part of your innate system. What we've been saying all along during this lecture, that all of these factors can potentially lead to low-level inflammation, psychological stress, chemical stress, lack of exercise. Okay, exercise increases your inflammatory anti-inflammatory systems. Exercise increases your anti-inflammatory systems and your antioxidant systems. Okay, these neutrophils are part of your innate immunity, and what we're finding, this is a report. This is a report out of 2020, because it's very recent. What they're finding is that these neutrophils are excessive in COVID patients, particularly COVID patients that have not done well. And part of the theory is that these neutrophils are already high because of other disease, because of heart disease, because of kidney disease, because of diabetes. So they already have a quote unquote boosted immune system because the neutrophils are already on surveillance. And what happens is they get these clumps of neutrophils, and it's causing more tissue damage. Okay, so neutrophils in the lungs basically are responding to the tissue damage, but they're doing it excessively. So this poor man went to the hospital. He was dead in 5 hours. Okay, he had tremendous comorbidities or other disease going on. But the point is that this person had a healthy immune response. This person had an unhealthy immune response. Why is that? Well, we kind of know the answer, but we're not talking about it enough. Okay. All right. So culture. All right. So where does that leave us? Okay. Where does that leave us? Okay. There was a great, in my opinion, a good op-ed by David Katz that was back in March. Is our fight against coronavirus worse than the disease? He advocates for protecting the vulnerable and allowing the healthy to basically go about their lives with some restrictions. Okay. I have to say I'm not an expert on this. There's pros and cons for physical distancing. From what I've read, it works very well the earlier you start it. So I kind of agree with Katz that we should be making some modifications, but that's really not what this lecture is about, and I'm getting off topic a little bit. Sorry. So what's going to happen? Well, we really don't know. Is the virus going to mutate? Will there be multiple waves? Will it stop spreading like SARS and MERS, its cousins? Will it stop spreading? Yeah, it could, but it's infected many more people, unfortunately. And what are the treatments? Okay, so this is important to me, okay, because again, I'm trying to educate people so that you can be empowered to ask better questions so that you have less fear. So there's something called sunken cost fallacy, right? So what's going to happen is there's going to be many physicians, doctors, alternative healthcare providers providing, and they're going to be touting that they've helped coronavirus people, or this and that. Not the severe ones, okay? The severe ones are hospitalized. I'm talking about people with mild to moderate cases that are probably going to get better anyway, or likely would be better anyway, right? But they're going to be touting these treatments, all right? And there's something called sunken cost fallacy. When somebody invests their life or their money or their energy into a treatment, they're more likely to believe that treatment works. This is from the physician side or from the healthcare provider side. They're more likely to be emotionally attached to that treatment. They're more likely to believe that it works. That has an effect on the patient. Okay, so these are biases that are very commonly known. Okay, that has an effect on the patient to have a positive response. Well, great. Okay, but we need to know the difference between, whether what money you're spending on as far as the treatment goes. Is it worth it, or is it just a very, very strong placebo effect, right? And there's also confirmation bias. So confirmation bias is when we read or see something that corresponds with our own beliefs, we're going to be more likely to believe that and to not, and we're going to discount anything else. Okay, so these are very common with treatments from the patient side and also from the healthcare practitioner side. So we have to just be aware of these so we can ask better questions. Okay, and then of course everyone talks about the vaccine. Okay, everyone talks about the vaccine. And there's many companies right now racing for the vaccine. It takes a long time, the vaccine. Most of the companies right now are either in phase 1 or phase 2. There's at least 3 phases, and they last for months. So there's not going to be a vaccine for a while. And frankly, the vaccine on coronaviruses, the history is not really great. There's no really comparison. But since we've been talking about all of these health factors and building your health and building your resilience, and that's kind of the point here, is that we're focusing, in my opinion, on the wrong things. We're not focusing on building our health enough. We're not focusing on our resilience. We're not focusing on why people are so amazing, okay, as given the survival rate, right? We're not focusing on the incredible adaptability of the human being, all right? We're going to place our emphasis on a vaccine, and I'm not anti-vaccine by any means, okay? The measles vaccine has a 97% success rate. Amazing, okay? Genius. The diphtheria vaccine, like 75, 80%, right? However, our best comparison for maybe a potential respiratory disease like coronavirus is the damn flu vaccine. And what's the data say on the flu vaccine? Okay, well, this is for the last 10 years from the CDC. Last year, 29%. In 2014-15, 19%. Why did I circle these two? Why are these starred? Because in these 2 years, this is when the highest number of the US population was vaccinated. Okay, so I'm not anti-vaccine. I'm anti-bad vaccine. Okay, I can show you data that shows that if you participate in exercise, cumulatively over time, it gives you a 50% reduction in upper respiratory infection. May or may not be the flu, but I'll take 50% over 29%. Okay, and it's not an apples to apples comparison, but it's in the ballpark. All right, so I'm not going to put my emphasis, frankly, personally, on waiting for the vaccine. I'm going to try to keep myself as healthy as I can, and I'm not going to be scared. But that's just me. Okay, so we can't be living in this culture of fear. All right, it's too much, frankly, in my opinion. Look at this. Does this look familiar? I gave a picture like that earlier. Okay, this culture of fear we're living in. We have to be vigilant. We have to be smart. Okay, we're not saying that we're not living in a dangerous. This virus is not dangerous. That's not what we're saying. We're saying the response and the media coverage and everything that's going on around us to develop this culture of fear is not healthy. And we live in a culture of fear, in my opinion, because we lack understanding and we lack faith in our human bodies. We lack faith in our resistance. We lack faith in our own adaptability. And I think the point of this that I'm trying to make is that if we change our perspective, we can change our fear, and we can still be vigilant and be smart about certain physical distancing. We can be smart about our food. We can be smart about washing our hands. We can be smart about protecting our vulnerable if we have to, not see our grandparents and just do, virtual visits. But we need to, in my opinion, we need to change our perspective on how we look at the human body, how we look at ourselves, how we look at health. And there's many, many, many factors to this. There's many socioeconomic factors. I realize that. I'm not trying to paint a pretty picture here as much that it's easy. But the perspective, the thought, the attitude is harmful. And if we just change a little bit of how we perceive the body and how we build health, instead of focusing on the virus and how scary it is, if we just focus a little bit about how strong you are, and the data shows that we're pretty strong, because the death rate, the survival rate is going to go through the roof. And what I call the survival rate, the death rate is going to fall because there's so many more people infected that we originally thought. So we must be a pretty resilient species, a pretty resilient people, because the earth has never seen a virus like this before, and yet most people are going to be okay. Why is that? It's because we're strong. And we need to focus on that more than the death, which is, again, ugly, and nobody's discounting that this is serious. But the perspective has to change. That's all I'm saying. We need to start changing our attitude and our perspective to create this culture of health instead of culture of fear. Thank you for listening. I wish you all well.